So, Alexis, you say that Molly's been acting strange lately?
Yes. She washes her hands until they're raw, and she has to do things multiple times before she leaves them alone. Once she wasted an hour before school trying to see if the door was locked. Can you figure out what's going on?
Well, it seems she might have obsessive-compulsive disorder, or OCD. I won't jump to conclusions, but it is common for kids around her age to have OCD. Did you know that about 1 in 200 kids have OCD in America?
Wow, I never would have linked her strange behavior to OCD. Is it really that common?
Sadly, yes. Over 3 million people in the U.S. have OCD. Although there are no tests that we can run to diagnose Molly, I can look over the symptoms in Molly's medical history to determine a definite answer. Alexis, has Molly ever had any scarring, memories, abuse, brain abnormalities, or major illnesses? Has anybody in your family had OCD? All these could be causes to OCD.
No, nobody in our family has ever had OCD. I wouldn't call it abuse, but earlier this year Molly was in a bus accident.
Thank you, Alexis. This could have been a cause to Molly's behavior. You can go in the waiting room with Molly while I assess the information. Hello, Molly. How are you feeling?
Fine, I guess. I just don't really know what's going on. After the crash, we found out that I had post-traumatic stress disorder, but what's going on now is different. I just feel like there's this overpowering voice in my head, telling me to do things I normally wouldn't obsess over. It controls me. I have to do whatever it says. People say, oh, just don't wash your hands as much, or lock your door the first time, but I can't. And it really frustrates me. They don't get how hard it is for me.
I see. Molly, did you know that about 10 to 40% of OCD sufferers have PTSD too? It's not really that abnormal that you're feeling this way. A lot of people with PTSD have OCD.
So I have OCD and PTSD?
Well, after analyzing your data and medical history, yes, you do. But there was nothing in your power that you could have done to prevent this. Don't worry, there are lots of medications and therapies you could use to help OCD.
Like what?
The most common medication is called SSRI, or Selective Serotonin Reuptake Inhibitor. This helps activate the serotonin chemicals in your brain.
Is this the only thing?
If SSRI isn't effective, I would suggest using tricyclic antidepressant. Dry mouth and sleepiness are some of the possible side effects, though.
Didn't you also say something about therapy?
I did. CBT, or cognitive behavioral therapy, is usually the most effective psychotherapy for OCD. It helps reduce stress, anxiety, and resolve inner conflict.
Good, I have hope. I just couldn't deal with these conflicting actions and feelings any longer.
I'm glad I could help explain what was going on. So Alexis, it seems that Molly has PTOCD. Don't be alarmed, this isn't a whole new disorder to learn. It's a person who has PTSD and OCD. Out of washing, cleaning, hoarding, counting, checking, and some other common obsessions, Molly has checking and washing.
Ah, that explains your strange behavior after your PTSD diagnosis.
Yes, it seems that even if the accident didn't occur, Molly still might have been diagnosed with OCD because she had insufficient serotonin levels in her brain.
Serotonin?
Serotonin is a chemical in your brain that involves your mood, sleep, pain, and appetite. Don't worry, Molly can take medications that will make these chemicals more active.
Okay, thank you, Dr. Quartermain.
No problem. If you have any questions, just call my office.
I will.